Hey friends, Jen here. It's been a little while since I have, kind of gone live on my Instagram feed. Been a little bit busy as I'm starting clinical care again because I took a little break running the Sim Center here in Boston, and now I'm excited that I'm seeing patients. And so as I get back into patient care, and you know, with everything going on related to healthcare today, I thought it would be helpful to weigh in on a few things. And in particular, I thought I'd take this moment to talk about measles. So, you all know that measles is running rampant. And in fact, we are seeing it now, cases in 12 states, and it's likely to continue to spread because measles is an extraordinarily the most highly contagious, one of the most, if not the most highly contagious disease out there. But we have good prevention, and that is vaccination, which again, I know many out there are afraid of vaccines, but really this is the most important way to protect yourself and your children. So just to help you as you're thinking about if you're not vaccinated, whether or not to get vaccinated, let me tell you some of the concerning complications, because I think it's a misnomer that measles is a benign infection. And yes, back in the day, so many kids had it because it's so contagious, and thankfully back then maybe many kids survived, but really there are so many complications, and the death rate was so much higher because we didn't have the ability to prevent infection. And so now we do. And let me just tell you what those complications are. Number one, immune suppression. Okay, and then a subsequent secondary infection. So what do I mean by that? Is the measles virus, when it's in you, can actually suppress your immune system such that you can get another infection, either due to a virus or a serious bacteria. This immune suppression is real, and it's actually one of the important components of measles-related death and complications, what we call morbidity and mortality. Second to that, measles also causes diarrhea, which is actually one of the most common complications of the disease, and that is absolutely no fun and can lead to kids having to come into the hospital due to dehydration. Third, pneumonia. So, I'm a pediatrician, and pneumonia turns out to be the most common cause of measles-related death in kids. And this happens in approximately 6% of cases. So it's not a rare complication. And so this is really important for parents to know. And last but not least, one of the complications that I think are the most scary are the neurologic. And so what are the neurologic complications that can come from measles? Well, number one is encephalitis. Encephalitis happens, unfortunately, in too many kids, 1 per 1,000 cases of measles. And encephalitis, because it's an inflammation of the brain, it can actually be very high risk. It starts off with fever, headache, vomiting, stiff neck, and then can lead to convulsions and coma and potentially death. And so that is definitely something we don't want any child to suffer from. The second complication neurologically is acute disseminated encephalomyelitis, also called ADM. This is a post-infectious complication. It actually affects the neurons, the myelin around our neurons, and it occurs in about 1 in 1,000 cases as well, similar to encephalitis, and it happens in the recovery phase of measles. And this can lead to very big complications for kids. And again, ADEM can lead to paralysis, bladder loss, bowel control loss, back pain, seizures, mental status changes, and it can be associated with significant rate of death. So 10 to 20% of kids that have ADEM or acute disseminated encephalomyelitis, yes, ADM, can die. The last one that I think also scares me a lot, and which is why, I would never not vaccinate my kids or myself, is something called subacute sclerosing panencephalitis. And what's scary about this is that it is a fatal complication of measles. It's a progressive degenerative disease of the central nervous system that typically occurs 7 to 10 years after you've had a measles infection. So again, we don't completely understand why this happens, but we know it happens, and it's something that you can't prevent, and you wouldn't even know if you're going to get until 7 to 10 years later. And so again, patients with what we call subacute sclerosing panencephalitis typically become ill 7 to 10 years after their primary infection, and it is it is really bad. And it is 100% fatal. So, again, I share this with you as a concerned fellow parent, as a pediatrician, and I hope that you all who are not sure, on the fence, or not thinking of getting the measles vaccine, please get it. It is spreading in our country, and it's only going to spread more. It is highly contagious, and it does have these complications that are not worthwhile when we know the vaccine is so safe and it does not cause autism. So that has been studied on multiple continents, multiple countries, hundreds of thousands of children. Good studies, good science. So we know that that is not the case. So please protect your kids, protect yourself, and stay well, everyone. Take care. Bye-bye.